Today I'm going to talk about something called reactive arthritis because I was asked a question about it and I think it would be a good thing to talk about. So reactive arthritis is arthritis that's a reaction to something else. It's not a primary arthritis like osteoarthritis or rheumatoid arthritis. And what does it have to do with infections? Certain infections can trigger arthritis symptoms. So that's swelling and pain in your joints. The notorious culprits are gastrointestinal infections. So something like salmonella or campylobacter. Those are very common bacterial GI illnesses that cause diarrhea, abdominal pain, and that's usually it. But in a small proportion of individuals, they can develop arthritis after those GI infections. So what's happening? So usually this is not just anybody. These individuals that develop reactive arthritis sometimes have a predisposition. They might have markers for autoimmune disease. There's something called HLA-B27, which is a very detailed gene signature, but people that are positive for that gene marker are more likely to get reactive arthritis. And what's happening likely is an autoimmune process is triggered. When you have an infection, your immune system revs up, and there is cross-firing, there is collateral damage, there is friendly fire, and sometimes that can set off an autoimmune process. And we always have known that infectious diseases can set off autoimmune processes. And we think that Epstein-Barr virus, the cause of mono, might be causing multiple sclerosis. We know that certain autoimmune disorders can cause after an infection can cause your level of platelets to go down. You can get many different types of autoimmune disorders. Guillain-Barré syndrome is another one with paralysis. So that's likely what's happening with reactive arthritis. The other time you can get this is with certain genital infections, urethritis or inflammation of the urethra, that can also lead to reactive arthritis. And you treat reactive arthritis with non-steroidal anti-inflammatory drugs like ibuprofen, and it usually goes away. For more severe cases, you have to use steroids. Some people develop chronic symptoms. So this is just a lesson that infectious diseases can have a cascade, because remember, every infectious disease is an interaction between the infecting pathogen and your immune system. And if your immune system gets revved up, it might set off an autoimmune process. It might set off an inflammatory process like reactive arthritis. So if you have salmonella, if you have a GI illness and you develop aches and pains afterwards, it could be reactive arthritis.